Hi, everybody. Today we're going to be talking about exercises and treatment for arthritis in your hands. Let's get going right away. So arthritis in the hands is a very common issue, especially with elderly people. The telltale sign is stiffness, especially when you haven't moved for a while. So usually it'll be in the morning when you wake up, or if you've been sitting still or not moving your hands for a period of time. When you start moving them again, you feel stiffness in the joints of the fingers and the hand. And then as you move, usually things tend to get a bit better, so the stiffness will dissipate a little bit. As always, please do your due diligence, meaning if you have a lot of pain or these exercises are not helping you, please see your local healthcare professional or doctor to get a proper diagnosis. But these are general exercises and tips that'll help most people with arthritis in the hands. So let's get going right away. First thing to do is try to remain in motion as much as possible. So as I just said, not staying still or not moving for long periods of time tends to make arthritis worse. So the solution to that is keep active as much as possible during the day. And if you're resting or not moving for certain periods, try to wiggle your hands or wiggle your fingers every once in a while. And so let's get going now for some easy exercises that you can do to help yourself. So first off, you can start by just opening and closing your hands. I like to do this about 20 times or 30 times to get the blood flowing in your fingers and get the hands warmed up a little bit. A second stretch I often like to give is called the prayer stretch. So here you'll be putting your fingers, your palms together, putting your hands on your heart, and then drawing your fingers down. So if you start off, it's easy. If you go lower and bring your elbows up, it gets a bit harder. So if you have a lot of arthritis, your fingers might be stuck like this, which is fine. Just try to keep them together. I'll show you from the side, and then come down like that. Okay, you can hold that for about 3 to 5 seconds, and then release, and then keep going again. Okay? Second good exercise, so that's to open the hands. The third exercise, which we did the warm-up, the second stretch, now the third exercise is to try to help the fingers close better. So often in people with arthritis, the index finger and the middle finger will stay open a little bit like this, so they'll have difficulty closing all the way, and then eventually all of the fingers. So what you can do to help yourself is just make a fist, and then use the palm of your other hand, press on these knuckles over here, and then just press inward, hold 1, 2, 3, 4, 5, and release. And what's good about this exercise is you can do many knuckles at the same time. 1, 2, 3, 4, 5, and release, okay? Then there's many different knuckles in the hand. So there's this first knuckle that we worked on right now, but if you want to work the middle knuckle, what you would do is keep the fingers flat like this, and then you can go press on the middle knuckle like this, or even with your fist closed. And instead of pressing on the top of the fingers, you would press on the side here. So 1, 2, 3, 4, 5, and release. And again, 3, 4, 5. If you found that you have a lot of pain, press less hard. If you find that after you do these exercises, pain remains, that means you're pressing too hard or you're holding too long. You can hold 3 seconds or even just hold 1 second, press in and come out, press in and come out. Last bit, these last knuckles over here, what you want to do to get those is you can put your hand like this, right? I'll show you my hand right here. And then put your other fingers on the tip of your other fingers on them like this and press inward. So if I go like this here, I'm just pressing, I'm making a fist, and then I'm pressing the last knuckles inward over here. 1, 2, 3, 4, 5, release, and again, 1, 2, 3, 4, 5, release, and you would repeat that 5 times. So we started with the warm-up, we had the prayer stretch, we had knuckle 1, press in, knuckle 2, keep the fist, press in, knuckle 3, the hand like this, press in. You can also do it with your hand facing the other way. It doesn't matter. Okay? The other part is that often people with arthritis, their knuckles are going to start to look like this. They can't get their hand flat on a surface or flat on the a table. So what I like to give them as an exercise, and I'll show you right here, is you stand beside a surface. So I have my treatment bed over here. I'll just move my chair so it's out of the way. And you're going to put your hand on a table or on a surface. It could be your kitchen counter or anywhere. And then you can come with your other hand and just gently push down on that hand. Now, if you're on a wooden or glass table or some very hard surface, it would be better for you to use a towel, not too thick, like a small layer of towel, just so it's not hurting your hand. And then you can start and push down with your palm on the knuckles over here. Okay? Just gently. So what I'm doing, just gotta get a bit closer, is I'm pushing down with my fingers on the knuckles over here. Okay? So you can push down, release, push down, release, push down, release, and repeat that 5 times. And then what I like to do is to get a stretch of the wrist at the same time, or the stretch of the inner arm and the wrist. So you would hold the web of your finger around the other finger. So the hand that's over top is on top of the other finger, and the web of your hand, right, like so, is on the other hand, okay? And then with this elbow stays straight, and you're moving your body across, right, to the side. So at some point, you'll start feeling a stretch in the fingers and in the arm as well. And you can hold there for 1, 2, 3, 4, 5, and release. And again, 1, 2, 3, 4, 5, and release. Okay? Of course, you would do both hands. And these are good stretches to do once a day. You can do them, if you do them twice a day, you'll see faster gains or more gains. But often with arthritis, it's not a matter of making big gains, but trying to prevent the joint from getting stiffer and also from you losing your range of motion. Because what happens when you don't do exercises and treatment for arthritis is that eventually, basically, you can't bend your fingers enough to hold a spoon, and you can't open your fingers wide enough to grab things that you want to grab. So your whole goal is to prevent that from happening and keeping the range of motion in your fingers. As well, doing these exercises should reduce the pain and discomfort that you feel in the fingers. In terms of other treatments that you can do, you should consult your medical doctor about this, but there is some limited evidence that in some people, taking glucosamine, chondroitin supplements can help, although it's not something that's proven for sure to help everyone. So I've seen patients where they take it and they say it helps, and other people say that it doesn't give them much benefit. And these are things that you should check with your local pharmacist, especially if you're taking other prescription medication. You want to make sure that if you're going to be taking these supplements, they don't interact with your other medication. As well, the other thing you can do is, if you're having periods of lots of inflammation, then you can consult your pharmacist or doctor about taking Advil or other natural forms of anti-inflammatories like turmeric pills, for instance. Some natural health food stores sell those. And again, this is not a prescription. I'm not your medical doctor, and you need to check with your pharmacist or medical doctor to make sure that there's no interaction or no issues with you using such products. All right, well, that's it. I hope this was helpful. I'm Mokhtar Akbari, physiotherapist here in Ottawa, Canada, and we'll see you next time.